Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. Today we are going to look at the right way to do your blood pressure at home. Generally, the more information that you have about a patient's blood pressure, the better it is. So we are encouraging patients to have their blood pressure recorded at home. For you to be able to record the blood pressure the right way, you first of all need to have the right blood pressure machine. The right blood pressure machine is the machine that where the curve that you are going to use fits the arm of your hand, and it is not too tight or not too loose. So you measure the circumference of your arm and be sure that the blood pressure machine fits appropriately the right size for you. Then before you do your blood pressure, you should make sure that 30 minutes before you do your blood pressure, you have not taken any coffee, you have not eaten, and also you have not exercised, because this one can affect your blood pressure. And also you should not be feeling like you want to go and use the toilet. You should first of all use the toilet if you feel like you need to use the toilet, and so that there's nothing that is stressful. And then the room that where you're going to do your blood pressure should be quiet, not a room where you are looking or watching at a television, or there are distractions around you, because all these distractions will be distracting to your taking the blood pressure. The best times to do the blood pressure, we usually recommend for home recording of blood pressure, you do it early in the morning, just after you have woken up from the bed, and you give yourself about 5 minutes for you to completely get ready. Give yourself 5 minutes, and then you can get the blood pressure taken. So when we come to the positioning, when they are doing the blood pressure, you should be able to have seated well with your back well supported, properly supported, your feet well on the ground without them hanging or not stretched up, just like the position that I am in. Then after you have made sure that is the positioning, then you should do the blood pressure when you are not talking, you are not looking at anything. Your blood pressure, you should concentrate. Once you hit the start button to do your blood pressure, then you should not talk anymore. You should just concentrate on having the blood pressure. So I'm going to just start taking. So you do, and then after you have taken it, you relax for 1 minute and then repeat it again. The next blood pressure that you should take, you should do it possibly early in the evening before you take your supper, or half an hour after you have taken your supper. So those are the precautions that you need to do for you to take the blood pressure appropriately. One thing is, if you find that your blood pressure is high, the normals we are talking about, the systolic blood pressure, which is the part that measures the blood pressure when the heart is pumping, should be between 90 and 140. And the diastolic, which is when the heart is, immediately the heart relaxes before after it pumps blood, should be between 60 and 90. If you find that your values are outside there, repeat it after 1 minute, and don't panic even if you find your blood pressure is high. Talk to your health provider so that he can give you the advice on what to do if you find your blood pressure is high. Thank you very much for watching. I encourage you to go to our YouTube channel and subscribe to our channel, and also share and like our channel. Thank you very much. For more videos, we'll be talking